Hello, everybody. This is Dr. Gita Mathai, and this is my Health Vibes channel. Today, we are going to talk about bones, osteoporosis, and the weakness of bones. Do you know that our bones do not remain the same size from birth until death? When we are born, we are tiny, and then the bones grow and we become taller and taller, and some people even reach 6 feet in height. Our bones are the frame on which the muscles, fat, and skin hang. So, if the frame is weak, the body will wobble, the body will be distorted in size, and if the bones don't grow, we will remain short. It is not that bone grows and the same bone keeps on growing. Bone is remodeled constantly, and the entire skeleton it changes every 10 years. Children grow in height until they're about 20 years old. And after that, after the age of 50, some people become shorter in height. They may lose even 2 to 3 centimeters of their height. And when you look at an older person, a relative, you might say, oh my goodness, how has this person suddenly become so short? Have I grown taller? No, it is not a perception. The person actually has grown short. This is because the bones become weak and they shrink in size, and the cartilage between the bones of the spine also degenerate and become smaller in size. So the whole person shrinks. In order for the bones to be strong, sufficient calcium has to be present in the body. This calcium can be obtained from the diet, from milk, dairy products, from egg yolk, from fish, and calcium can be obtained by vegetarians from some of the nuts and some of the vegetables. The problem with the calcium from the diet is that sufficient quantities are not obtained. An adult needs 1,300 milligrams of calcium a day, and a child needs around 600. So you may say to yourself, oh, I'll just drink more milk and I'll get the calcium. But remember that 100 ml of milk only contains 135 milligrams of calcium. So how much milk are you going to drink? You will become very fat if you drink 1 to 1.5 liters per day. Then, in order for the calcium to get into the bones, vitamin D is essential. Vitamin D is the sunshine vitamin, and it is formed normally when sunlight falls on the bare skin. So, most of the people do not get enough vitamin D. They stay indoors, they don't go outside, and even when they go in the sun, they carry an umbrella. But you might say, I don't want to take any medicine and I want enough vitamin D from the sunshine. You have to stand in the sun with bare minimal clothing, just your innerwear, for 2 hours a day. In our culture, this is not really acceptable. But this is easy to do for children. You can strip a child down to its underwear, apply coconut oil from on the whole body below the neck, and keep the child in the sun for half an hour or more. The requirement of vitamin D is around 600 international units per day, little less in children and slightly more in adults. This amount cannot be obtained from the diet alone or from standing in the sun, so you need to take supplements. Vitamin D and calcium supplements are necessary for most of the people, otherwise, their bones become very weak and brittle. And as they get older, the slightest fall will cause a fracture of the wrist or the hip or some other bones in the body. It is not just the intake and the deficiency that impacts bones. Certain diseases cause the bones to become weak. Thyroid diseases, diabetes, autoimmune diseases, cancer, intestinal diseases where there is malabsorption, and so the vitamin D and the calcium are not absorbed or utilized properly. Also, fat people tend to have better bone density, and although being thin is recommended for almost all diseases, lose weight for diabetes, hypertension, everything, being thin makes you more likely to have weak bones and osteoporosis. Also, if your diet contains a lot of caffeine with the form of coffee and tea, and you tend to take it strong without much milk in it, or you put a lot of salt in your food, the calcium absorption is negatively impacted. Some of the medicines which you have been prescribed for diseases may also decrease your calcium and your vitamin D and make your bones weak, particularly steroids and medicine taken for proton pump inhibitors taken for acid reflux. These diuretics, which wash out the salt from your body, also tends to make your bones weak. If you want to investigate for weakness of the bones, you need to check a calcium level, phosphorus level, vitamin D level, and also a bone mineral density. If your bones are found to be weak and you're osteoporotic, then you need to be investigated for certain other diseases as well, like thyroid diseases, parathyroid hormone, and if everything is normal, then you only need supplements. Remember that you have to build up your bone stores, your calcium levels in your body from the time you are young. Otherwise, when you are old, your bones will be so weak that the slightest fall will break them. And if you don't want to land up like that, please look after your bones. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe and press the bell button. The same content is available in Tamil. Thank you.